side of the fence in our profession who think that we should become musculoskeletal specialists. Here's a paper that was published in nothing less than the Journal of the American Medical Association, done at Stanford University, Why Patients Use Alternative Medicine. Because medicine wanted to know why there were actually more visits to chiropractors than there were to primary care MDs and DOs. And what do you think they found? Okay? Put this in context. This is from the Journal of the American Medical Association. Largely because they find these healthcare alternatives to be more congruent with their own values, beliefs, and philosophical orientations toward life and health. Philosophy is what's driving people to so-called alternative providers. And what are these providers like? Are these uneducated, gullible bumpkins that go to these charlatans like chiropractors? Well, they found that 37.2% of U.S. households use some form of so-called alternative medicine. And what do you think the most common reason was? Did they say, gee, I want an expensive, mediocre treatment for back pain that costs thousands more than a Tylenol but doesn't work any better? No, that's not what they wanted. The most common reason was to improve general wellness. This is a survey of 23,000 adults done in 2006. And who were the primary users? What was the demographic characteristic of individuals that use so-called alternative care? Get this. Those with annual incomes exceeding $100,000 and those with postgraduate degrees. The smartest, the richest, the most successful people are the ones that are starting to lead the wellness revolution. And the reason they're doing so is because of philosophy, and they're overcoming what Canadian psychologist Keith Stanovich called dysrationalia, which is inability to think and behave rationally despite adequate intelligence. Again, I'm not into diagnosing and treating disease, but this is pandemic in our profession, as we're going to see. And certainly more devastating than H1N1 flu. And there are those in our profession that would have us limited to those interventions that have been shown to be effective for specific diseases through randomized clinical trials. And here's a great paper that actually appeared in the British Medical Journal called Parachute Use to Prevent Death and Major Trauma Related to Gravitational Challenge. Isn't that a great idea? Systematic review of randomized controlled trials. And here's what they came up with. They said, as with many interventions intended to prevent ill health, the effectiveness of parachutes has not been subjected to rigorous evaluation using randomized controlled trials. Advocates of evidence-based medicine have criticized the adoption of interventions evaluated only by observational data. We think that everyone might benefit if the most radical protagonists of evidence-based medicine organized and participated in a double-blind, randomized, placebo-controlled crossover trial of the parachute. I would be willing to help fund such a study with certain factions in chiropractic. Because, folks, this is what it's really about. Here's what Dr. Barris wrote in the book Authentic Knowing. If we are serious about coming to know something, then our research methods will have to be adapted to the nature of the phenomenon that we're trying to understand. One may need to draw on the totality of one's experience, knowledge, experience, intuition, not just a subset that consists of observations made through the process of traditional scientific discovery. Because, folks, as you well know, what's the big political shtick out there? So-called healthcare. Healthcare reform, the healthcare crisis. And again, it doesn't matter which side of the aisle you're on the issue. Here's the facts. We spend approximately $2.5 trillion per year on so-called healthcare. That is about twice as much as the next country that is comparable in terms of development. I mean, the next developed nation spends about half of that. 17% of the gross domestic product, and do you know that 62% of all U.S. personal bankruptcies are attributable in part or in whole to inability to pay health care costs? 1 out of every $6 goes to health care. In 2015, it's felt that it'll be 1 out of every $5. Can you imagine that in 2005, people were spending nearly $7,000 a year on so-called health care, and they think that it's going to be over $12,000 by 2015? That Medicare hospital insurance will become insolvent by 2019? Guess what? They just pushed the date up to 2016 to 17. These are the Medicare trustees themselves. The government accounts already for about 2/3 of health care spending. State Medicaid expenditures exceed those for education. And a lot of folks will say, well, you know, it's worth it. We've got the best medical technology in the world. But let's look at what we're getting for it. Medical errors and iatrogenic events are a leading cause of death in the United States, and according to the World Health Organization, we rank 37th in overall health care performance in the world. 37th. Once again, nothing less than the Journal of the American Medical Association reported. This is a quote from JAMA. This is not a patient education brochure from some chiropractic office. 180,000 die each year, partly as a result of iatrogenic injury, the equivalent of 3 jumbo jet crashes every 2 days. Another publication of the AMA, American Medical News, said that drug-related problems cost as much as $182 billion, kill as many as 198,000 plus people, put 8.8 million in hospitals, and get this, account for up to 28% of all hospital admissions. 28% of hospital admissions are due to iatrogenic problems in outpatient practice. Public Citizen, a consumer magazine, back in 1994, said that there are several causes of preventable death that we need to address in this country. Cigarette smoking, alcohol, and guess what number 3 was? Ahead of traffic fatalities and firearms deaths, medical malpractice. 80,000 deaths per year, 1 every 7 minutes. Now bear in mind, iatrogenic stuff occurs without the doctor making a mistake. They're just saying, hey, stuff happens, you know. Here they're saying there are 80,000 more due to medical error. And a lot of folks will say, well, you know, we in chiropractic don't have the evidence base that medicine does. We have anecdote, we have testimonial evidence, but we don't have high-quality RCTs. We don't even have good case-controlled studies. Well, David Eddy had this to say in the British Medical Journal, that only about 15% of medical interventions are supported by scientific evidence. This is partly because only 1% of the articles in medical journals are scientifically sound. And this isn't gratuitous medic bashing. This is simply acknowledging what the status quo is, what the de facto standard in our society is today, what our society is willing to tolerate and pay for. And it's insane for us to attempt to copy this system or to attempt to acquiesce to the flawed epistemologic paradigm that it represents. Indeed, just a few months ago,